That's an example of how starting on one pill is not just starting on a pill. It's an entrance into a whole lifestyle of more and more pills. Next thing, this is a very serious one. I'm going to spend some time talking about diabetes. It turns out that the pills that you take to lower your cholesterol increase your blood sugar and increase your chances of developing diabetes quite significantly, especially if you're a woman. This gentleman, Dr. Ma, he published an article just 3 days ago in the Archives of Internal Medicine that said women who are postmenopausal who are given these cholesterol pills have a 71% chance of developing diabetes from the pill. Now, why is that such a big deal to me? Because diabetes increases your risk of heart attack. So let's talk about numbers for a minute. This graph here shows what your risk would be if you were a 51-year-old woman, maybe overweight, maybe with a family history, but without diabetes, non-smoker, without high blood pressure, with high total cholesterol and a pretty good HDL. I see this quite a lot for women at that age. Her risk of heart attack, either with or without the pill, is so small you really can't even appreciate it at this magnification, the 100% scale. You have to zoom in to see, well, up close to 4%. You can see that her risk without the pill is only 1%. And so with the pill, it drops the risk by 20%, drops the relative risk, it's not going to give her an absolute risk of negative 19%, that's no such thing. It gives her a risk now of 0.8%, so it doesn't drop it down to nothing. It just drops it down from 1% to 0.8%. In other words, 1,000 women just like her will have to take a pill before any one of them would have had a heart attack prevented by the pill. Now, what's going to happen to her 9 years down the road? Well, according to this study, her chance of having diabetes is 71%. So, whereas if she did not develop diabetes, if she was never put on the pill, or if she was never put on the pill, her risk still now at 59 is a little bit higher than it was because she's older. Risk goes up with age. So it's 2% instead of 1%. Now, with on the pill, the risk is going to be dropped from 2% to 1.6%. But there's a 71% chance that her actual risk is going to be doubled because she just took the pill for 9 years and got diabetes from taking the pill. So you're taking a pill to prevent heart attacks that increases your risk of having a heart attack. That makes no sense to me. But interestingly, that article, I have not heard a peep about it in the media. Instead, what went in the media was a debate between this gentleman here, who is a cardiologist with Johns Hopkins, and another woman cardiologist here on the West Coast in San Francisco, who were debating whether or not we're giving cholesterol pills to too many people. His take was, of course we're not. What he says, in fact, is that it's sort of silly to have this conversation in 2012 about not giving a cholesterol-lowering medication to a person who has dyslipidemia, meaning high cholesterol, and other risk factors like family history or being overweight. This is Dr. Roger Blumenthal, and he told HeartWire in his interview. He goes on to say, I'm not sure why she, meaning this woman cardiologist, and some others have taken an extreme point of view that would be considered malpractice in the 48 continental United States, and probably Alaska and Hawaii too. So this gentleman is seeing it as a big joke that there could be any downside to taking a cholesterol pill. To even consider it is an extreme point of view. That's all that the debate was about, was considering that not everyone needs the pill. And I'm bringing this up just so that you can get a sense of the extreme pressure that doctors like myself are under. Not based on statistics, not based on understanding of the chemistry or the evidence, but just based on like the peer pressure that is out there in medicine and the subtle threat of malpractice even for having a conversation with your patient about that pill might cause diabetes. So let's go on to consider a few more of the side effects that are written right there in the package insert, not an extreme place to go looking for information. One of the most common things that I see under musculoskeletal disorders is myalgia. That means your muscles hurt or your tendons hurt, and sometimes your joints also hurt too. Now, this is extremely common, very common in men, especially muscular men. And I just recently met a gentleman who was 150 pounds. He's 5 foot, I think he's 5'8". He was 150 pounds when he was put on his cholesterol pill for a heart attack he had 6 years ago. And when I met him, he was 250 pounds because the pill made his muscles hurt so much he stopped exercising. And no, he has not had another heart attack, but he feels bad, and he's not happy about the way he looks. And his belly was so big, actually, this is a businessman. When he came in to see me, he couldn't tell that his zipper was unzipped. So that's just one of the other side effects of taking a cholesterol pill. Women, when they get muscle aches, are very often diagnosed with fibromyalgia. And fibromyalgia is very difficult to treat. Once it develops, unlike these other things that the men with their muscular aches, the fibromyalgia type stuff is not so easy to reverse. Oops, sorry. Also, not very reversible, not always reversible, are some of the nervous system disorders. Now, the nervous system is made of 15% cholesterol by weight, and when you block the ability of the nervous system to manufacture cholesterol, as you do with these pills, some more than others, and in some people more than others, you can get very serious effects in the nervous system. In fact, I didn't know this, but until I looked it up, there's a research protocol where they give animals, where they're trying to develop an animal model of dementia or neurological problems. They actually give them a form of a cholesterol pill that's not available on the market because it affects the nervous system a little more strongly than the others. But that's how they create this model. And by blocking your nervous system's ability to manufacture cholesterol, you block the nervous system's ability to form new connections, to learn new things, and even to send signals and to send neurotransmitters, so that you can get depression symptoms, you can get anxiety, you can get forgetfulness, you can actually even very likely get dementia. And there's a researcher named Beatrice Golem who works in Southern California. She's a neurologist. She is studying the link between multiple sclerosis and other serious degenerative disabling neurological disorders in people who have taken cholesterol medications. Of course, you don't see her interviewed very much. Another very common side effect is infection. The cholesterol medications also block not just your ability to make cholesterol, but also something called mevalonate, which is a basic building block for all kinds of things in the body. And when you cannot manufacture mevalonate, you can also not manufacture, in some cells, in some people, cell surface markers that help your body determine which cell is yours and which cell is bacteria's. And so when the white blood cells can't make these determinations, invaders can get in, and you can get serious infections, including not just bronchitis and sinusitis, also other research shows pneumonia, sepsis, and joint infections. And joint infections can require surgery and can cause serious disability. Finally, one of the very, very common things is skin problems. Your skin needs to manufacture its own cholesterol in order to form the waterproofing layer. And when it can't do that, you can get dry skin. Again, not all people will get this. What you get, what symptom you get, depends on your personal internal metabolic balance. Because a lot of these pathways that are blocked, there's other workarounds and other metabolic pathways to get from here to there, and some people's bodies can do this, but not everyone's. So very often we see dry skin because of the inability of the skin to manufacture cholesterol. I can see people getting weird little red patches on their skin that look, things that look like psoriasis. People with psoriasis can get worse psoriasis, and there's also maybe, seems some evidence shows that there's an increased rate of skin cancers, non-melanoma skin cancers. So now I want to switch gears for a few moments and just go over what I tell my patients to do.